Alrighty, y'all. Our next speaker is Zach Dechant of Texas Christian University. Actually, this is my second time to introduce Coach. I introduced him in Orlando in 2012 because he had just written an article for Training and Conditioning working with pitchers in baseball, of which was my responsibility. It was an outstanding article, and many of the principles he outlined in there we still use in our strength program. Today, Coach will be talking on protecting the throwing athlete, considerations for baseball and softball training. Coach is an assistant strength and conditioning coach at TCU, where he oversees the development of baseball as well as assists with football. Coach's previous experience has included time at the University of Wyoming, 2 seasons with the Los Angeles Angels of Anaheim, 2 years at Missouri State University, as well as time spent with the University of Washington as an intern. Coach graduated with a bachelor's degree in health and wellness from Missouri State University in 2003. He is certified through the CSCCA, NSCA, and USAW. Coach?
Thank you. Appreciate it. Make sure everything's working here. Can everybody hear me out there with this mic on? This one's good? All right, good. Today we're going to talk about protecting the throwing athlete. My name's Zach Dechant, like Coach said. I'm the assistant strength coach for TCU. I handle TCU baseball. This is my 9th season there at TCU. Prior to that, a couple seasons with the Anaheim Angels. So for the most part, everything that I've been around has been baseball oriented. In this presentation today, I wanted to give everybody basically something they could take home right now and implement in their program. One of the best presentations I've ever seen was 2012, 2011 and 12, somewhere in there, 11 or 12 at Kansas City. Coach Gillespie did a great presentation on basically his 25 years plus in the field of strength and conditioning. He basically gave tips and tricks that he uses to help his athletes get better, and it was one of the best presentations I've ever seen. I felt like I never got as much out of somebody presenting their program as I did as when somebody came up and showed me some different ways to do things, exercises, some tricks, tips here and there that you could implement right away. So that's what I wanted to do with this presentation. We're going to talk about 3 areas basically specific to baseball and softball: the shoulder, the scapula complex, the thoracic spine, and then the hip, specifically hip internal rotation. One thing I do have to talk about real quick is your PowerPoint that you guys have in your folder there with the CSCCA. They gave me kind of a short notice as far as when I'd be presenting, so that was kind of a rough draft of what we started out with. So it's not going to match the exact PowerPoint that we have up here today. And the other thing with that PowerPoint, the sheets that you have there, we couldn't put videos in that and email that presentation out. So you're not going to see any of the pictures for the videos in there. Every slide looks blank for the most part because we have so many videos. But they will be putting this the new PowerPoint on their website, and they're making a video of it, obviously for CEUs and things like that. And then we're going to post the videos that we have here today. We'll post them on the YouTube site that I have listed at the end of the presentation. With that being said, let's go ahead and get started. One of my former bosses and mentors is presenting after me, so I cannot be late on this presentation. All right, we're going to talk about the scap just to start out with a little bit. Weakness on the left side presents injuries on the right side. All right, the main scapular stabilizers, the rhomboids, the levator scapula, the traps, and the serratus anterior. These are what we're going to be talking about today in the first part of our presentation. When we have problems or weaknesses on the left side, we get injuries to the shoulder, to the rotator cuff. All right. Rhomboids, the inability to get retraction equals anterior capsule problems, all right? When a pitcher or a throwing athlete, I shouldn't say a pitcher, when a throwing athlete cannot get full retraction in the rhomboid, we have to get it with glenohumeral hyperextension, all right? We put pressure on the anterior capsule. Rhomboids are super important. We're going to talk about all this stuff later, but this is just kind of an intro here. Huge eccentric activation during the throw, especially in the rhomboids to decelerate the scapula. The levator scapula, we're not going to talk about the levator. The levator is honestly not important to the throwing athlete. We actually want to deactivate that. We want to do less work to activate the levator than anything else except the upper trap, all right? With the levator actually pulls the scapula into downward rotation. So we get glenoid fossa. The glenoid fossa actually drops inferior, all right, closing off the subacromial space. We don't want that to happen. So we, as you'll see later, we don't do shrugs or anything in our program to activate the levator scapula, the upper trap. We don't want to do any of that. We don't want to strengthen those muscles. All right, we're going to talk about the lower trap a lot and posterior tilt, and then the serratus anterior. Those are going to be the two main topics of our presentation today. You can see down below, most shoulder complex injuries incurred as a result of sport activities can be traced to abnormal biomechanics, which in turn are related to improper functioning of the scapular muscles. The meat and potatoes of this statement is scapular instability is found in as many as 68% of rotator cuff problems and 100% of glenohumeral instability problems, all right? 68% and 100% of the problems that you guys have, that you guys see with your athletes in the scap and the shoulder are due to scapular instability. That shows us how important those muscles surrounding the scap and the rotator cuff are. All right, so scapular control, what is it? We are fortunate at TCU in that we have a physical therapy clinic that works with our athletes. So we have a physical therapist on staff year-round to work with me and the baseball kids. Every one of you in here, I'm sure just like me, has a kid that's presented with some shoulder pain. They go and see an ortho, whatever. They go to a physical therapy, and the physical therapist tells you, well, he can't activate his lower trap. He's got no scapular control. And you're thinking, WTF? Because we do Ys, we do rows. I know what I'm doing with the scapula. We do all those things. And they say, well, I don't know what to tell you. He can't activate the back side there. So I actually sat down, and we wanted to figure out what scapular control is to us. This is the most important aspect of injury prevention that you're going to see in a throwing athlete. All right, so to me, what we came up with as far as trying to control everything, we want to eliminate compensations. The more you can eliminate those compensations, the more we can activate, all right, especially the lower trap, getting into the serratus. All right, the major compensation that you guys see, every one of us sees in here, is that rib flare. Anytime we're doing Ys for the lower trap, any lower trap activation that you guys see or that you guys do, what you want to see or what you often see is the rib flare, the ribs popping out, all right? We don't get a whole lot of activation out of the lower trap when we compensate with that pattern. We're going to show you some things today, how we eliminate that with the addition of the foam roll. I've got an example down the way just a little bit that'll help you with that. Number two, we want to control the movement, all right? So we use varying tempos. We do a ton of iso and eccentric work, eccentric especially. When I was first coming up in the field, Buddy Moore said something that has always stuck with me. He said, the throwing athlete loses eccentric strength first when he gets in-season programs and the volume of throwing goes up. The eccentric strength of the rotator cuff goes out the door. All right, so we want to control the movement. We control a ton of tempo with our scapular and our rotator cuff exercises. All right, and the third one is the mind-muscle connection. We want the athletes to understand what's going on with the scap, to understand what movements we want them to perform. Posterior tilt, we want to inform them on how and what they need to feel when it comes to posterior tilting the scapula, or an upward rotation, or rolling the scap around the thoracic cage in the case of a serratus exercise. All right, getting protraction. We want them, honestly, we use our hands-on a lot with these kids, all right, especially when they get in with our developmental program, something we've started using in the last year or so. Is having kids stand behind each other and pushing in on the posterior aspect, on the inferior border of the scapula, to hold that in when they're doing an eccentric rotator cuff action so that they don't go into anterior tilt. We want these kids to understand what they need to perform with those movements, all right? Visualize the firing patterns. We touch them back there where the lower trap is. We want them to understand that we're using the lower trap and not the arm. We want the scap to control the humerus. That's a big thing, the scap to control the humerus. So with a lot of our eccentric work, we tell them the arms are just hooks. That's all they are. That's just a hook to the barbell, to the weight, to the rope, to the cable, to the band. The arm is the hook. We want you to feel this through your scap. Utilize your scap to lower this, because most kids, when they're doing a Y, I keep using the Y, but it's a perfect example. When they're doing a Y, they can be doing the Y without ever doing anything with the scap. They're just lifting the arms. They're moving through the shoulder. We don't want that. We want them to move through the scapula on those patterns. So we tell them, hook or utilize the arms as a hook, fire the scap to do the movement. Again, we use a ton of eccentrics with this. This is where I think this comes in real handy, is the eccentric work. We lower it with the scap. We don't lower it with the arms. So eliminate the arms. Upward rotation. This is the biggest movement we want to worry about with any throwing athlete. We want a proper acromial elevation. Most of you guys know, if you work with baseball and softball, I would guess most of you know and realize that there's a three-way force couple happening in the scapula to achieve upward rotation. It's the upper trap, the serratus, and the lower trap. Today we're going to talk about the serratus and the lower trap. Those are the most common weak muscles in the complex. When you have upper trap dominance over the lower trap, that equals major dysfunction. All right, I should have posted a few of these on here, but there's dozens and dozens of studies out there that show when the upper trap dominates over the lower trap, you're going to have dysfunction. All right, we want to increase the strength of the lower trap. We want to deactivate some of the activity that the upper trap has. We'll show you some of these things that, or we'll show you some of these in a few minutes here. The rotator cuff, two functions. There's only two functions of the rotator cuff. It's to depress and stabilize the head of the humerus. All right, we want the rotator cuff to counteract the deltoid. We actually don't do any direct deltoid work whatsoever at TCU. We don't do any. Lateral raises, front raises, none. The deltoid overpowers the rotator cuff, causes humeral elevation. It pulls that humerus basically up into the acromion process. All right, we want that space to be as big as we can have it. We want to create a huge space underneath that acromion for them to get clearance when they're overhead. If we don't, you're going to look at primary and external impingement. All right, guys, start talking about anterior shoulder pain. They come across here, raise that elbow up. Yeah, I've got pain. I've got a pinching right there. We don't want that. We don't want to do we don't do direct deltoid work for that purpose. All right. We also don't do internal rotation either. We're going to talk about that on the next slide. All right. Internal rotation is already heavily trained. These kids do an internal rotation movement every time they pick up a baseball. All right. The lats, the pecs. Huge internal rotators. We honestly feel that there's not a need for that. We don't need to do more of it. There's a few, very few, but there are a few cases where we do isolate some of the subscapularis. The subscapularis is actually the only internal rotator of the rotator cuff, and it prevents anterior translation of that humeral head. So when you have guys that start presenting with anterior shoulder pain, we might isolate the subscapularis and try to train that a little bit to pull that back into the glenoid fossa. All right, we don't want that anterior head sliding forward too much. So there are a few select times that we do some subscapularis work, but we don't train internal rotation. We don't do this with our guys, ever. Release and strengthen. We want to release the front side. We'll talk about that in a little bit too. Release the front side, strengthen the back. The upper cross syndrome that Jonda talks about. Total body rotator cuff. For us, once we get through our developmental program, our rotator cuff program becomes total body. All right, we add complex movement to ordinary cuff work. It's good for glute activation. It gives us a nice single leg exercise. We can go through movement patterning with our pitchers. You'll see in some of the videos. To me, these are all good things for throwing athletes. We want to be able to integrate, honestly, the hips with the scapula. The hips and the scapula work together. So that's how we program our rotator cuff training. The other thing, too, is it allows us to integrate a little bit heavier loading. Instead of sitting here on your side with a towel, on a 2.5-pound plate, which I don't know about you guys, but I can't watch my kids do this for 51 weeks or however long we train. I guess it should be. I shouldn't say that. It's probably more like 48 weeks, but it's year-round. We're not going to do that. We've got to progress into something that's more complex. We've got to progress to something. All right, allows us to get a little bit heavier loading. So we have two forms of our rotator cuff training: static stability and dynamic stability. Static stability is what I refer to as just regular rotator cuff stuff. All right, your standard loading rotator cuff. We use a lot of tempos, like I said earlier: eccentric, isodynamic. We might do a 10-second pause followed by 10 to 15 reps. I've got an eccentric there where we go a 4-count eccentric for 8 to 10 reps. We might do one arm with an iso. So we might go one arm iso up here, the other arm's doing 10 to 15 reps, and then we'll switch. We'll show you all that on the videos in just a second. But that's your standard rotator cuff. We call it static, just to eliminate confusion. The dynamic stability. Dynamic stability, you guys have seen probably more in a physical therapy setting where a guy holds his arm out and they take it through basically multiple planes, reactive training. All right, it's reactive stabilization in all planes of movement. The shoulder, the arm goes through a faster movement than any other activity in sport. All right, so that shoulder has to be able to dynamically stabilize at high speeds. We don't approach the speeds with dynamic stability that a kid does when he throws a baseball, but this is probably one of the closest links that we can get to. All right, you're trained in proprioception, kinesthetic awareness, where that shoulder is, where that ball and joint is in the socket. All right, we can make it position specific. Today I'm going to show you how we integrate dynamic stability into some of our static work as well. All right, so this is one of the ways that we eliminate the compensation pattern that we talked about earlier. Wise on a foam roller. All right, we're doing a ton of stuff right now on a foam roller. It allows us to get our spine flat, the kids to understand that my lower back needs to be touching the foam roller so that I can pull my ribs down and keep those tight. Then it allows us to move through our range of motion. The reason we do this on a foam roller, though, instead of on the ground or on a wall, is we're laying on our scaps. We'll talk about it in just a second also with the serratus. When we're laying on our scaps, your scaps don't move. All right? We don't want to lay on something and then try to get them to move. So I love the foam roller because now I can actually wrap my scaps around that. Keeps the lower back flat. We cue them to push that lower back into the foam roller, abs stay tight, and pull down the ribs. That way we eliminate this compensation. All right? When they have a compensation, they're not actually training the lower trap. We don't want to see them go into hyperextension when they're doing their lower trap work. So if you see kids going into hyperextension for Wise, it's a problem. All right, our ISOT. This is some of our, let's see here if I can get the mouse working. There it goes. All right, our ISOT and Wise. The basis of our developmental program is the YT Cobra, what I call the Cobra down low, and external rotation. We teach that from day one with our developmental group. Something that we progress to is where we start adding a little variation with the ISOT and the Y. Mouse disappeared again. There it goes. All right, so we'll show the video here. We're holding an ISOT, and then we go into 10 dynamic Ys, 10 to 15 generally. Sometimes we'll actually lighten the load with 2.5-pound plates, or we actually have 1-pound plates for some of our rehab guys. But we'll go into 15 to 20 of those with a 2.5. With a 5-pound plate, we might do 8 to 10 reps. All right, so just changing the movement pattern to get away from the standard Ys, Ts, and Cobras. There's nothing amazing about this right here, but we've used this in the last 2 years. We've just started using this in the last 2 years, I should say. We got this from one of our pro baseball guys. We do the same thing on the ISO Cobra and the dynamic external rotation. We hold an ISO Cobra on the right side into external rotation on the left. All right, so we're just, honestly, in a way, it's confusing them a little bit. They have to think, they have to work a little bit more to achieve these patterns than your standard Ys, Ts, Cobras that we've been doing for 6 months. If you guys have any questions along the way, feel free to kick a hand up. All right, we go into some of our static work here. This is our more complex. Rotator cuff training. That stuff before, that's really not. That's more lower trap. This is the complex stuff that we were talking about. All right, so we go into a single leg flexion extension. We actually changed the name of this to gator chomps because our kids just, it resonates a whole lot better if we call them gator chomps than single leg flexion extension, but started out as a single leg flexion extension. We go into a Cobra at the bottom. All right, it's the same pattern we just used laying down, but now we're integrating it with a lunge position. Okay, so we actually have 2 ways that we train this. We can train this, as you see it, Andrew doing it, one of our former athletes, where he goes into what we call a face pull, so directly into external rotation. We also have a pattern where we break this up and 2-part it, where we go into the row first and then the rotate and back down. So it's always a two-part movement. So we can break this up. We have him in a split stance, basically. What we want out of that split stance is we want him to get over that front leg just like he's pitching and push off. So all it is a reverse movement of the pitching process. We're just training the backside now. So our single leg gator chomp, single leg flexion extension. All right, we go into our squat into external at 0. So we have three ways we'll do this. We're only going to show you 2 today. Our squat into external at 0. All right? Two ways again to do this, where he goes straight into external, all right, lets it out. We'll also go straight into external and rotate back, all right? So we have a two-part with that too. The rotate with the row, which is what he's doing right there. So we'll go external at 0, down low like that. We'll go external at W at 45 in the scapular plane, and then we'll go external at 90 as well. External at 90 is what we have next. This is with our single leg movement. We're in a single leg squat into external. All right? We could do this. We showed you this variation because this gets to single leg. We do this at a double leg also, double leg, double arm. Single leg straight up into external. We do this with our two-part movement again. We can either go straight from a face pull, or we can do it with our two-part. Face pull, straight up into it, let it out, or we can go into our two-part with the row, rotate up. We utilize all this stuff with our pitchers. Tons of single leg work, obviously, with the pitcher. We'll talk about that in just a second. Single leg flexion extension with dynamic stability, all right? This is where we get into some of our dynamic stability. Now, we do dynamic stability out of every position that you guys see it in. On the floor, where you're holding the arm up in the scapular plane. We'll do it on a box in different positions. Arm slot, follow through, so they'll hold out here. We'll go eyes open, eyes closed. We start with dynamic stability in all those planes first. And then as we get into in-season, we start integrating dynamic stability into the rotator cuff work, because honestly, I don't have time to be doing a ton of extra work in season. I mean, just like you guys. We want in season to be efficient, time efficient for us. So what we found is let's integrate dynamic stability into their actual rotator cuff work so we don't have to do rotator cuff, scapula exercises. Now we have to do dynamic stability. Then when we go to the field and we do bands and rotator, I mean, how many times are these kids going to do rotator cuff a day? So we integrated this into our static work so that we could eliminate one of the steps. So this is our single leg gator chomp, flexion extension with dynamic stability here. Everything we do is in the sagittal plane for this. We don't get outside of that. All right, so he'll go in, and we're showing it with bands here, the orange bands, light resistance. Everything in the sagittal plane, forward, backward. They can't stabilize this way. They're holding the weight, whether it's a cable or a band. They're obviously pulling back with it, so they can't stabilize side to side. We don't want to make that a priority in the pattern. So everything we do is front to back. All right? So we'll generally do this for 10 to 15 seconds, and then they'll go into their reps. So the exercises that you just saw, same thing, 10 to 15 reps. There's a couple other exercises at the end of this that we add dynamic stability to as well. This is just another variation. This is our band L's with dynamic stability. So he'll open up, same thing. It's the same exact movement for the most part. All right, we're just integrating the dynamic stability into our static strength, into our static movements. All right, we're going to move on to the serratus real quick. John first noted the tendency for weakness in the serratus with the upper cross syndrome. Basically, the way kids are today, sitting at a computer, playing video. I mean, we have video games in our locker room. The kids sit in the locker room and play video games when they're not playing baseball. Everybody in here probably has video games in their locker room. The kids sit all the time. That's all they do these days. We're tight on the front side. We're weak on the back side. Serratus anterior weakness basically leads to a loss of stability in the glenohumeral joint. That requires the levator scapula and the upper trap to make up for it, basically, to maintain centration. All right? We said earlier, we don't want the upper trap and the levator to have to kick in to help us stabilize the scapula. Those are two bad things. We don't want that. All right? We want the lower trap and the serratus to be the ones doing that for us, the rhomboids, the middle trap. All right? Oftentimes, very, very undertrained. The serratus, I would bet, is probably the weakest muscle that we have in that complex of scapula stabilizers. It's the chicken versus the egg. Is there pain in the shoulder because the serratus shut down? Or is the serratus shut down and that's what gives us pain in the shoulder? All right? The chicken versus the egg. We don't know what comes first. But when there is shoulder pain, the first thing that they say shuts down is the serratus. The bench press versus dumbbell bench press versus push-ups. We are a push-up school as far as our baseball program is concerned, especially with our pitchers. When you're laying on your scaps, you can't activate much. You can't activate anything on the backside. All right, the push-up is excellent. It's an excellent exercise. I've written several articles on that because it's great for more than just if you want to train the chest. All right, it's a scapular exercise. We get a core component out of it. we use the push-up a ton. Here's one thing when we're training the serratus anterior, don't use unstable objects, all right? Don't use a physio ball. Studies actually show that there's decreased activation. I mean, this goes for a lot of stuff with a physio ball, but there's decreased activation in the serratus when we utilize a physio ball to try to do scapula, to try to do serratus anterior work. You have to understand your goal. We think, well, the stability ball is going to increase the, we're going to increase the needs for stabilization, but you don't actually increase the needs for the serratus to stabilize. If you go to that research article down at the bottom, what has to increase the stabilization for the scapula is the upper trap. The upper trap is what picks up the slack when you're on a stability ball doing work. The serratus is unable to activate as much. All right, so you guys probably see this just as much as I do. The training room, scap push-up, push-up plus, and dumbbell press-outs. That's what they utilize for the serratus. That's, to be honest, all we ever see. Those are fine exercises. We, again, want to progress those. I can't watch those for 50-some weeks out of the year, 40-some weeks out of the year. We want to progress those. There's more than that for us. The elevated scap push-up, you get way higher activation levels with the elevated scap push-up. The further away that you get the humerus from the torso, as far as when we elevate the humerus away from the torso, the further away that we get, the higher the activation pattern. All right? So we'll actually go into some work here where we talk about bringing the arm up even further. How do we progress that elevated scap push-up? We'll raise their butt up even more, all right? Andrew's not that far away from parallel right now, but we'll raise his butt up even more. You can pick his feet up, raise his feet higher. We'll even have him walk their hands out. So we'll start, you know, maybe we do 2 weeks at chin level. Then we'll walk hands out. Now you've got 2 weeks at eye level. Then we'll walk hands out. You've got 2 weeks at forehead level. All right? Elevate the humerus away from the torso. You're going to get higher activation levels in the serratus. All right, then we go into serratus wall slides. I don't have a video of this. We didn't put this up because I feel like this is a fairly common one. I think Cressy posts about the serratus wall slides quite a bit. There's quite a bit of info out there. Pushing the elbows out. We use a foam roller on the wall. Pushing the elbows out. All right, elevating all the way up, trying to wrap the scaps around the thoracic cavity. All right, we use a foam roller. We even use we'll throw a band in around the wrist so we get a little bit of an external rotation component as well once we progress. Once we progress through those earlier stages, we throw the band in. So the elevated scap push-up is the foundation movement for us with our developmental class when they come in. Some other things that we'll utilize: overhead shrugs. We don't do a whole lot of overhead shrugs, but it is a good exercise because it eliminates the evil levator scapula. The more we can take out the levator when we're doing upward rotation, the better. You basically take the levator out by putting it on slack. It's a downward rotator. When you upward rotate, that levator goes on slack, so now we can train the trap, the serratus. You even get some lower trap in there with band overhead shrugs. We don't do a whole lot of work overhead. To be honest, we don't do any work overhead except maybe a few band overhead shrugs once in a while. The banded push-up jump, where you're hanging a band in the rack, dropping it down, kids get in, bands across their chest, and they're doing an explosive push-up, jumping off the ground. That is the best serratus exercise I've ever found, all right? Yes, it puts a lot of stress on the shoulder joint, so we don't use it a whole lot. We do in the off-season. But when I do these with my kids, or if I do them in my own program, when we do them for high reps or time, usually 15 to 20 seconds or 15 to 20 reps, something like that, it feels like I broke 6 ribs on each side of my rib cage. It's the only thing I've ever utilized that I feel soreness in my serratus the next day. All the other serratus exercises we do, I don't get sore from that. Maybe you guys are different. This is the only thing I've ever done that I know I have a serratus. So I would challenge all you guys to throw this in one of your workouts one time and see if you feel the same thing. When we talk about the banded push-up jump, we're talking about jumping as high as we can, throwing out the arms. It's not something where we're just casually popping up and down off the ground. We have our kids try to hit their heads on the bar. So if we set a bar, what we call at level 10 with the powerlift rack, we're having our kids jump so high that we want them to try to hit their head on the bar. And then we'll talk about the serratus pull apart in the next video, and then band cable elevators. We use this a little bit. Sean Gross actually has a great article on this. He has a good progression too. It's a great progression actually. It's seated to standing, so you might go take a look at that. We use this with our stuff. We don't do the seated progression. We actually just progress it into standing. Once you see the serratus pull apart, it'll kind of speak for itself. All right, so our serratus pull apart. We use 2 bands on this. So he punches out with the one, and then he does a retraction movement on the other. All right, it's the same stance as we would. It's a stance specific to throwing, basically. Left leg forward, right arm's punched out, retract, row across that backside. We do this sometimes with thumb pointing out, so we get a little bit more middle trap, an external rotation component at the shoulder. One of the cues that we'll use on the next video, we use it on this as well. We'll have a coach stand in front of him with his hand, because what happens is, a lot of times your kids, it's a complex movement. We're trying to screw them up. So as they start rowing across this way, they let that shoulder glide back. We'll have a coach a lot of times stand in front with a hand, all right? A visual reference for them to try to punch out and touch the hand. So I'll stand out there. You'll see it in the next video that we want a visual reference for them to remember to punch out with that serratus. So the band cable elevator, you can do this with the band, you can do this with cables. It's the same exact movement pattern, all right? So he punches out and then follows the hand, trying to punch it the entire way up. Now, this is one of the other ones that we talked about earlier. That I said there was going to be examples of something else for dynamic stability. This is something else we can use with our dynamic stability. So we'll go band with the punch, all right? Out at the top, we can apply light dynamic stability in any direction. And on this, we emphasize light. We're not trying to tear his arm off at the top because he's in a pretty compromised position, pushing that band out. All right, so our band cable elevator. All right, we get to the pec major, pec minor. We talked about it earlier. Release the front side. The upper cross syndrome, the pecs, the front side becomes super, super tight. All right, the pec affects a whole lot. Scapular tilt pulls the scapula into anterior tilt. The pec minor attaches at the acromion process, or coracoid process, sorry. Pulls the scapula into anterior tilt, and it affects humeral position, all right? Internal rotation. It pulls us into this position if we're tight. That's not an efficient position for a pitcher, any throwing athlete. Softball, baseball, it doesn't matter. That's not an efficient position. All right, we want that subacromial space clear. We've talked about it all day. All right, bicep tendonitis. This is one thing that I think a lot of people forget about. The pec inserts across the bicipital groove. So oftentimes a tight pec is what causes that bicep tendonitis. You start having a doc say, oh, he's got bicep tendonitis. We want to release everything on the front side then. The pec crosses that. If that's tight and pulling down on it, guess what? Now the bicep is going to have a problem. Okay, loss of IR and injury. I think it's widely publicized that loss of internal rotation equals injury. Newer research now is actually showing that loss of external rotation could be a possible cause of injury as well. All right? Everything that we do, we don't stretch external rotation. Everything that we do to increase external rotation is soft tissue work. All right? We destroy the pecs on a daily basis with soft tissue work. All right? We'll go through some of that. Questions that arise with the pecs. All right? It's the bench press. All of you guys have high school coaches, I'm sure, athletes, your own coaches at your college. They want to know about the bench press. Is it the most evil of them all? If an athlete can't maintain scapular control and has to go into glenohumeral hyperextension, all right, so when he goes down on a bench press or a dumbbell bench press and he crosses 90 degrees and starts rolling forward into it, and that scapula can't maintain stability back, that's when we run into a problem, all right? If they're rolling forward into that and having to go into glenohumeral hyperextension, now we have a problem. Now you're basically putting tons of stress, unneeded stress, on the anterior capsule. We don't want that. So when I was younger coming up in the field, the 90-degree thing used to drive me crazy. Why are we stopping at 90 degrees? That was kind of an old baseball thing. You know, you always did the dumbbell bench press at 90 degrees. You did barbell bench press to 90 degrees. Well, looking back at it, there actually is some validity in that. All right? Like I said, if they can't maintain that scapular control, then it is good to stop them. Even when you're doing a reverse pull-up or an underhand row, I call it reverse pull-ups, but what's another word for it? Inverted row. Thank you, Rockford. When you're doing an inverted row, you'll still have athletes that are super weak on the backside that will try to roll into that, whether it's because they're tight on the front side or because they're so weak. Really, it's a combination of both, but regardless, when they roll into humeral hyperextension, when you're doing that with a row, it's still a bad thing. All right, so if you see that shoulder rolling forward and we're going into a hyperextension on the humerus, a bad thing. We stop all of our kids if we see that happening at 90 degrees for their exercises until we can correct that with stabilization. All right, push-up variations. We talked about it earlier. Way more scapular involvement. The serratus. The serratus is a huge mover in the push-up. We can actually activate it. We can get into it. We can have the scaps roll around the thoracic cavity. It's a complex movement, and we get a huge core component. All right, so we're teaching more motor skills than just laying on our back pressing. All right, that's why the push-up is such a major player for us. So the pec minor release with the barbell. I think we actually stole this from Kelly Starrett. We love this. We use this every week with our kids, the release with the barbell. So we put it in at an angle, we pull that in tight, and we want to pull that in tight. That's not laying across the joint. We want to pull that in tight into the pec. And Andrew, it's not a great video. We didn't do a great job with this video because he's moving around the whole time. I don't know if he was confused about what we were asking him to do when we kept telling him to rotate. I actually wasn't there for this video, so that could be one of the reasons why this is a bad video for you. But we want to trap that barbell there. He lays the leg over lays the leg over the side to put pressure down into it. And now he rolls in through internal and external rotation. We go at 90 degrees, at 45, and then down here at 0. So we move him through the entire range of motion, trapping that pec minor. This is my favorite. This is the kids' favorite, favorite pec release that we do. Some of our kids will work up to where they put a 10 or 25-pound plate on the end of the bar just to get more pressure driving in. Some of the other stuff, you guys probably do it. We do the pec minor release with the lacrosse ball. We do two variations. We trap the arm behind the back, all right, and we'll roll crosswise on the pec. And then we'll also trap the pec minor. We'll trap the pec minor at the top, drive into the wall, and then we'll go into flexion. All right, so try to trap that tissue, moving through motion. The last one here is the pec minor release on the foam roller. Again, the foam roller eliminates our compensations. All right, if you guys have weaknesses with the lower trap, I suggest using the foam roller. So the foam roller allows us to separate the ribs from the scapula. He can flatten his back, tighten the abs on the foam roller. We'll push down. I believe this is a video. It is. So he'll go into a W, and he'll actually activate. It's somewhat of a P and F. So he'll actually activate on the back side, and then we'll drive down to try to separate the scapula from the rib cage. It's a great pec minor stretch, pec minor release. Again, that foam roller will eliminate compensations. All right, the T-spine. Let me just check time. Yep. All right. T-spine, it's obvious to rotational sports. If you don't understand that the thoracic spine is high on the priority list for baseball or softball, then you need to get to studying. Extension and rotation, extremely important, as well as activation for the internal and external obliques, all right? That's something that we've changed a lot with our thoracic spine movements, is we activate the internal and external obliques a lot more than just rolling through mobility. In the last couple of years, we've actually added we've put in breathing patterns, all right? Whether you do PRI or something else, breathing patterns are huge when it comes to thoracic spine movement. We're honestly realizing in the last few years. We focused on the ribs a ton. I'm not a PRI guy, but there is some great stuff that I have learned from PRI. But breathing and proper rib function, that's not necessarily you're not doing PRI. I mean, Pavel Susalini back in 2000 or 1995 or whatever it was with Bulletproof Abs. It's honestly a great book if you've never read it, but he talked about proper rib function, internal and external obliques with all your ab movements, exhaling, inhaling deep to get more activation out of the internal and external obliques. So it's not necessarily just a PRI thing, all right? Maybe it's been brought to the forefront through them, but I think it's honestly going to be a big addition to a lot of T-spine work in the future for us. I did a presentation back in 2011. Coach talked about it. All of our lying T-spine progressions are on there, our clamshells. You see those a lot out there on YouTube and things like that with different people. So if you're interested in those, go look at that 2011 presentation. Those progressions are in there. This is all of our standing stuff that we've implemented just in the last 2 years, more of our advanced stuff, I guess. Our rep schemes generally with the T-spine stuff, 3 to 5 reps, but we add the breathing pattern, the breathing cycle. So we'll hold an ISO in that T-spine exercise, and we generally get 2 to 3 breaths, all right? Inhale full, fully exhale, drop the ribs down, squeezing the abs, squeezing the obliques tight, and we try to force rotation even more, all right? When we exhale, we can get more rotation. You get the air out of the lungs. We're not as stable through the spine, all right? Everybody knows when you go down in a big squat, something like that, you have to pull air in to stabilize, higher level of stabilization. We want to blow all the air out so we get lower levels of stabilization, so we can increase mobility. All right, we have 2 ways that we do these. We create torque versus the object for the hard structures. That's not scientific. I call the hard structures, you know, bone, ligament. We're trying to create torque to increase mobility. And then we also do these for light pressure. So light touches on the walls to increase soft tissue activation. If you want to kick in the internal and external obliques, we go light pressure. All right, so our hip rotation with the T-spine towards the wall. Coaching cues for our kids, we're generally about 6 to 12 inches away from the wall with the feet, all right? We're going to get a hip shift. I'll talk this through real quick. We're going to get a hip shift first. We always go close to far on the movement pattern, all right? What we're trying to get these kids to realize is we want to spin the shoulders on top of the hips, okay? What you're going to see if you implement this with your athletes when you go home is all your kids, when they rotate, they'll get into that hip shift, they'll rotate, and they'll rotate back to the opposite side of that hip shift, and they'll want to bend over like this. You'll see their shoulders start dipping. What we want, and we have to cue with our kids constantly, is to just spin the shoulders on top of the hips. All right, you'll see that here. We get our hip shift. We're going to go close, all right, and then far. We try to keep the arms straight. All we're trying to do is rotate through the thoracic spine. One of the huge compensation patterns your kids will present with is they'll try to bend the elbows just to feel like, to get the visual effect that they're rotating further. We want the elbows straight in all of these exercises, all right? We get to the end of that movement, and that's where we go through our breath cycles. We can go through them on the close side. We can also go through them on the far side, one or the other or both. All right, here I'm just showing both. We stay in that hip rotated movement, though. We stay with our hip rotation throughout the entire movement here. We go close and then far, trying to separate the shoulders. So if we're doing this with hard pressure on the wall, pushing into it, allowing the wall to push back, now we're working on mobility, increasing that rotation. When we do it with light pressure, we're increasing activation levels in the abs. If you want to, in the obliques I should say, I shouldn't say abs, general statement. If you want to feel your obliques working, these exercises, I guarantee you'll cramp up the first couple times you do it where the obliques tie in the back. All right, the hip rotation with the T-spine away from the wall. Generally 6 to 12 inches away from the wall. Again, I'm not sitting back on the wall. My butt's actually off of it, but we'll get our rotation. We go close to far. Okay, this is all activation. We're not torquing against any structure here, so this is all activation throughout the obliques. We get our breath pattern at the far side on this one. All right, I just rolled through both sides for you guys. Compensation pattern you're going to see, like I said, is the elbows bending. They want to see their hands moving farther. It gives them the visual effect that, oh, I'm rotating further. Well, no, you're not rotating further. You're just bending the elbows to compensate for you not being able to rotate further. So we lock the elbows in as a coaching cue. Spin the shoulders on top of the hips. That's all we want. We're just spinning the shoulders. We keep that hip rotated position. All right, single leg lunge rotations on the wall. This has become my favorite, actually. So what we do here, we generally have the kids set up 4 inches. So I tell them to take their hand, fist width, set themselves up from the wall from here to start with, all right? Fist width away. Super tight guys, we scoot them out. If they're super hyper flexible, honestly, we can scoot them in. If it's too easy for them, we can scoot them in. We want to keep the feet and the hips square. We don't want those to rotate. All right? So we rotate up, eyes follow the hand, we get our breathing pattern in, and we try to reach both sides. Throughout those breaths, as we exhale, we're trying to get the kids to rotate more. Okay? So if you do this just for reps, once you exhale, you're able to rotate more. So an early level progression for us, we might start with on the wall, where they have both hands on the wall this way. basically like a clamshell you would do on a foam roller or something like that. This is kind of a second step progression where we raise the hand up onto the wall here. We cue the kids to drive the front side armpit into the wall. All right, we want to try to drive the front side armpit into the wall. Hips and feet stay square. You don't want to see them flying out with that. If they can't do that, we scoot them off the wall. Okay, you scoot them off the wall, the rotational requirement isn't as great. So single leg, we do the other side as well. We go close leg, we go far leg, both sides. Eyes always follow the hand. Still trying to separate the shoulders and the hips. And we always add our breathing pattern at the end. 2 to 3 breaths, deep in, pulling the ribs down. Questions there? All right, hip IR and the throwing athlete. The hips need motion in all planes for any throwing athlete, specifically a pitcher. This gets into a little bit more specificity as far as a pitcher goes. Everybody trains hip extension. We all train hip extension, hip raises, glute ham, RDLs. But is rotation really more important? In our sport, it probably is. I shouldn't even say probably, it really is. Our sport is based around hip rotation, all right? Flexion extension excites less than 3% of the capsular receptors. Internal and external rotation is what you want to be able to get in and out of the capsule, all right? That capsule is the most important thing to our hip health. Creating pressure changes in that capsule drives synovial fluid, all right? The more synovial fluid we can drive back and forth through that capsule, the greater the health of the hip, all right? The hip gets its health from capsular, from pressure changes within the capsule, driving synovial fluid back and forth. We love loaded hip motion, all right, in all planes. We train rotation way more than we train hip extension, especially in the last few years. 19 plus muscles used for rotation, all right, we only use 9 for flexion and extension. So we're going to specifically talk just real quick about hip IR. Yeah, all 3 of these topics, it kind of drives me crazy. All 3 of these topics, we could have spent a week on or more and still not touched on all this stuff, so it's hard for us to get in 3 of these topics in 50 minutes. We're trying to touch on some things here. We'll go quickly over the hip IR for these throwing athletes. Especially pitchers, we need front side landing leg, all right? We need to be able to get into hip internal rotation on the front side landing leg. All right, you can see all 3 of these guys here. They have to go into IR on the front side. If you are unable to go into IR on the front side, if a pitcher is unable to get into that front side hip in IR, leg flares out, we start dragging. The arm has to pick up speed to make up for hip rotation not occurring efficiently, and we get stress through the shoulder and the elbow, all right? We all know what's going on in baseball these days with the shoulder and the elbow, specifically the elbow, all right? So huge problems there. The hip IR is a huge component in shoulder and elbow health. All right, there's huge difficulties though with IR, creating more IR, all right? You aggravate FAI, okay? We aggravate impingement. Anytime you'd want to try to stretch, mobilize with a flex position into internal rotation. They say in athletes, 95% of athletes that have FAI or present with pinching when you go into flexion and internal rotation have labral tears. We all know our kids all have labral tears. If they did an MRI, every one of your kids, every one of my kids, they all have a labral tear in there somewhere, all right? That's just the nature of sport. We don't want to aggravate that more by trying to create more in a bad position, okay? We'll show you a few ways that we do it to keep them out of that position. Again, their bony anatomy is what part of that's to blame. It's not our training programs. It's sport and how they're built, all right? How their pelvis sits, how the head of the femur is designed. It's not going to be something that we can always correct, all right? And then PRI gets into a lot of these issues. You know, I'll let you guys go research that yourself. But so we start with our four-part system: soft tissue, mobilize. We want movement prep, and then we activate, all right? So the soft tissue, we want to smash the backside. We want to hit the glutes and the external rotators, especially the medius, deep rotators, the piriformis. We do everything you can think of: lacrosse ball, baseball, shot puts, softballs. Shot put used to be one of our favorites. We've transitioned into the more lacrosse ball work on those glutes now. But we want we want to roll those out as much as we can on the backside. Mobilize the posterior capsule. When we want to increase internal rotation on the front side, you need to mobilize the posterior aspect, all right? That's why we say we've got to do soft tissue on the glutes. The glutes on the backside, the piriformis, the medius, those are the decelerators into internal rotation. If you guys have ever, I've been at TCU for 9 years. I was with the Angels for a couple years. There's times where we still go out, screw around, and we'll throw a bullpen, just messing around off a mound with one of our GAs or something during a training day. When we have some free time, we'll go screw around. We'll throw a bullpen. There is nothing more sore on me the next day after throwing off of a mound than the backside of my front landing leg, all right, from the deceleration component of having to go into internal rotation. So that should tell you, if you want to know what you use as a pitcher, go out and get on a mound and throw 30 or 40 pitches. The next day will tell you what you need to train, all right? Nothing more sore than my glutes on the front landing leg. Tells me that's a huge component. So we want to release anything on the backside. We want to release the glutes, but we also want to get into the posterior capsule. That femoral head glides posteriorly when we go into internal rotation. If the posterior capsule doesn't allow us to glide posteriorly, we've got problems. Where are we going? All right, we want to get into the posterior capsule. We'll show you that stretch in just a second. We traction posterior and lateral with the band when we do those stretches. Our favorite, that's the number one, but our favorite, my favorite, I should say, hip extend or hip flexor stretch into internal rotation is with a band tractioning anteriorly. Now, this gets into some problems. Honestly, 50% of you probably think that the anterior capsule it's not necessary to mobilize. The other 50% think it's highly necessary. I'm in the 50% that think our kids sit too much, and we need to mobilize the anterior capsule a little bit. We need to unglue that. Some of our physical therapists disagree with me. Some of them do agree with me. So it's kind of a, you know, everybody's entitled to their own opinion. Right now, we think that we like getting into the anterior capsule a little bit with some traction. To be honest, it feels awesome, and it opens you up a whole lot. Maybe we're doing more harm than good. I don't know. I guess we'll find out. And then flexion and IR. We don't do this a whole lot. I do have a couple of pro guys that utilize some flexion with some IR in a traction position to get into that. But again, it's very difficult because now you're running into the risk of the FAI and creating impingement, all right, aggravating that impingement. So with our posterior capsule, all right, the one on the left there, we want to cross. We get in an all fours position, and we cross that front leg. From there, we drive all our weight onto that knee, all right, onto the femur to try to push the backside of the femur out of the capsule. Okay, so we're putting all the weight on the crossed leg into that knee, and then we shift back, all right? We shift back posteriorly to try to drive that femur out of the top of the hip, basically. Okay, we're mobilizing the posterior capsule. From there, we'll move around, all right? Move it around, as Kelly Starrett says. We honestly, I like a lot of Kelly Starrett stuff. We want to find those sticky corners, I guess. The second one, the extension with internal rotation. Extension with internal rotation. So we trap the back leg. Okay, we'll trap the back leg into IR and then go into our hip flexor stretch. This has been a huge one for us because this unimpinges anything you have with FAI. I've got several kids that present with FAI. We can do this stretch all day. They don't have any problem with it. But we're also getting into some internal rotation. All right, I know it's not specific. I know when a pitcher goes into a landing, into a stride, and a landing on the front leg, he's more in a flex position. But we're not going to aggravate FAI and cause labral problems when we stretch internal rotation. So these are our two go-tos as far as trying to open up the hip to get more internal rotation. Several years ago, we had a kid get bursitis. The only thing that our ortho could find was that he had lost some internal rotation on the front side hip. We did this. We were already doing this. He just wasn't doing it to our satisfaction, I guess. We did this for the next 10 days. Doc wanted to open up IR. 10 days later, he was back on the mound with no problems when originally they thought he had a labral tear. Found out it was bursitis, and like I said, Doc couldn't find anything else. We opened up internal rotation, and all of a sudden he was better. So these are our two go-tos for internal rotation. Our movement prep side, all right, this has become one of my favorite exercises to do with our guys as far as mobilizing the hip because it also includes thoracic. It also includes thoracic rotation. We get activation for the internal and external obliques. I stole this from one of our interns who was a strength coach for the Diamondbacks this previous off season. We do this in 4 planes. Let me get this mouse going again. So we do this in 4 planes. Every motion has 3 stretches, 3 glides to it. Forward, and we rotate each side, in and out. So we'll go forward, cueing the kids to stay tall, drive forward, not down. We drive to the leg, all right? So when they're in a 45 degree like that, what we don't want is we don't want the kids turning their hips and now doing another forward stretch to the hip flexor. We want to stay in that so we get basically the entire capsule. So we work the entire hip around through motion in all planes. All right, so we go forward 45, 90, and then we open up to the backside. Again, this is a great exercise for activation in the obliques. This is one, every time I do it, I'll cramp up. I'll cramp up where the obliques tie in the backside. We'll go through it one more time real quick. Just about done. All right, forward 3 stretches. Out to the side. Remember, don't let your kids open up and stretch forward to every position. All right, make them try to keep their hips square. Move the hips to the leg. All right, we're good there. We're moving on. Activation, this is the last thing. All right, the activation on the backside. Just a few rotational things that we work on. Band clamshells. We do a lot of band clamshells, internal and external rotation. We want to watch for compensations. One way that we do that, we kick a kid up against a box. So when we're laying down on the side for the band clamshell, we kick a kid up against a box so he has a reference of where he doesn't need to take his hip. All right, if your kids are rolling their hips in the clamshells, that's a compensation. They're not using their glute med to fire, to open up the knee. All right, so we want them to be up against the box so that they know if I feel pressure on my butt, I'm not doing it correctly. We want to open up the knee using the glute, not the hips, not the abs, not the pelvis. We want to utilize the hip. All right, the hip airplane, which we'll show you later. This is one of my favorite things. We do this with our developmental kids, and it's a great intro into our single leg RDL, but it also allows us to get internal and external into that hip capsule a lot. We have a couple progressions to that. And then single leg squats into various planes. A ton of single leg squats for activation. Rotating into internal and external. We do touches with the feet, so we'll go touches here. We'll go touches internal this way. We'll go touches with the hand. So I think some people call this a bowler squat, but we'll go touches with the hand visual this way, going into internal and external. All right? We want them to rotate their hips to where they're touching instead of just going down and reaching across like this. We teach them, take your hips where your arm's going. All right? So we actually have to actively get into internal and external rotation. All right, the last thing here is that hip airplane. We did a video on that. We've done this with PVC pipes, usually just with our developmental guys. We also use a box. But the hip airplane, I think, is great. You're going into internal and external rotation. All right, you get good rotation all the way through. It's a great entry-level progression for guys to understand what we're going to ask them to do on a single leg RDL. It allows us to sink into that hip and internal rotation. That is it. All right, so I'd like to thank the CSCCA for giving me this opportunity, our strength staff at TCU, the baseball program, and then Ben Hogan, where I get a lot of this information. We have a close relationship down there with Ben Hogan Sports Medicine. That's where a lot of this rotator cuff work that we do, the scapular work, some of the mobilizations with the hip. We get a lot of information from them. They've been awesome, so I have to say thank you to them. If you guys have any questions, my email's there. We'll post these videos on one of my, probably the YouTube website, but there's also other information out there. I used to do a blog. So if you ever have any questions, feel free to email me. Does anybody have any questions out there right now, real quick? If you do, feel free to grab me throughout the rest of the day, and thank you.